Hi, my name is Tim Long. I'm the President and the Administrative Clinical Director for New Life Medical Center, and today I'm going to talk to you about erectile dysfunction. Erectile dysfunction is very common, and men are very concerned about it, and it's extremely important that men are able to get healthy, strong, firm erections. And I think women just don't understand how important it is to a guy. 40 to 50%, depending on which study you look at, but 40 to 50% of the men over 40 years old have had some erectile dysfunction to some degree or another. In many cases, the erectile dysfunction is caused by physical issues such as heart disease, clogged blood vessels, cardiovascular disease, high cholesterol, high blood pressure, diabetes, all the medications for those diseases, obesity, metabolic syndrome, Parkinson's disease, multiple sclerosis, tobacco use. Tobacco use is pretty big too, because over time it constricts your blood vessels within seconds of you smoking, and that will definitely affect erectile dysfunction, especially as the older you get. Peyronie's disease, which is curvature of the penis, any type of drug abuse or alcohol abuse, sleep disorders, being tired, certain treatments for prostate, large prostates will affect that. Of course, any surgery. Performance anxiety is huge, and that doesn't have anything to do with your age or how healthy you are. You can be in total perfect health, should not be any physical issues whatsoever, but for whatever reason, you doubt that you're going to be able to perform, and it doesn't happen. And most guys have experienced it at some point or another. So performance anxiety is huge. Another thing that could be a big issue is, and this is not even a study yet, but they're getting ready to do a study supposedly, and that is in regards to pornography. Typically, they're finding that guys who have no physical reason for it, that the culprit ends up being pornography. And usually the way you correct that is just quit watching pornography for a few weeks, and your erectile dysfunction kind of goes away after that. But there's no proof, there's no studies on that yet. They're going to do one, but we believe that is a big issue as well. What are some of the psychological effects? Stress at work, stress in relationships. You can have anxiety or depression will cause it. Any type of mental health issue, but stress is a huge one. And like I said earlier, performance anxiety. Now, there's a lot of causes for it. Some of those can be, you can be reversed if you're willing to change your lifestyle a little bit, and we'll talk about that at a later time. But what are some of the immediate treatments or remedies for that? Like I said earlier, the first thing we're going to take a look at is, now I'm going to give you three options. So that it's the patient's choice. You can choose any of these three options where you want to start. But what we like to look at first is the testosterone therapy. Is your testosterone low? And after we go through a whole workup in the past history, and if you're having symptoms of low testosterone, we would prefer you to try the testosterone first, because if you can avoid the medications, the medications that you take will eventually quit working over time. Your body just adapts to it. You either have to take a stronger dose or just quit working altogether. So if we can correct it internally so you don't need any medications to get an erection, it's just basically because your testosterone is low, that's what we would prefer to do, because it's a better choice long term, we believe. And what we have found, this is purely anecdotal, is that 65% of the time when a guy comes in with erectile dysfunction, and it's his primary complaint, that if we get his testosterone levels to the normal levels, his erectile dysfunction goes away. And case in point, we had a patient about a year and a half or so ago, had not had an erection in 12 years. 12 years. His wife was very upset and frustrated and basically forced him to come in. He came in initially for penile injection therapy, which we'll talk about in a minute. When we sat down with him and talked to him, he had tried oral medications and didn't work. And this is purely anecdotal. This is his own personal experience, but a lot of times when you try the oral medications like Viagra and Cialis, if your testosterone level is low, they won't work. Or they're just not very effective. Well, we checked his testosterone and it was low. We gave him his first shot of testosterone, and within a couple of days, he had his first erection in over 12 years. Now, it wasn't able to maintain the erection for intercourse, but that was the first time he had an erection in 12 years. He came in for his second injection. Of course, he told us about that. After his second injection, he was actually able to have intercourse for the first time in 12 years. After his third injection, he didn't need any medication or no Viagra or Cialis at all. Just having his testosterone was normal, he was good to go at any moment. And that's what's great about if your testosterone is what's causing that and you correct that, you're ready to go at any moment without any need of taking pills or any type of the medications. So if at all possible, that's what we like to start. If that doesn't work, the next option is oral medications like Viagra, Cialis, Levitra, things like that. And we try to prescribe those in generic form because they're just as good and they're a heck of a lot cheaper. But those will work about 82% of the time. And then you guys are probably pretty familiar with those. The next thing, almost last resort, before actually having an implant, is penile injection therapy. Now, penile injection therapy is where you take the medication and you inject it directly into the penile shaft. And you have to do it every time you're going to have intercourse or have an encounter. So it's not a one-time shot that works for days. It's every time you're going to have intercourse, you have to inject your penis or penile shaft with the medication. And it takes about 5 or 10 minutes for it to work. And ideally, you will get an erection from 35 minutes to an hour and a half. Typically, about 45 minutes is what we're shooting for. It does work 97.3% of the time in clinical trials and all the published studies. So it's very effective. It's been around for over 30 years. It's FDA approved. You just don't hear much about it because it's usually administered by a urologist after a gentleman's had a radical prostatectomy and he's had nerve damage and it's just nothing's working. That's the only thing it will work because it works regardless, even for people who've had quadriplegics. It will work. It will give you an erection. It works 97.3% of the time. So it's been around for a long time. If it's safe, if it's used properly, just like any medication. The difference between us and a lot of clinics that do it, if you're going to a urologist, they usually don't want to mess with it. They'll push you out to someone like us. But the way a lot of clinics will push it, not a lot, but a few clinics will push it, is they will guarantee an erection on the spot. So what you do is you go to their clinic and they give you a shot in the penis right there on the spot, give you an erection, and you can see it works. So you're excited to have that erection, so you're willing to do almost anything or pay anything to be able to have the erections that you want. And they charge several $1,000s for that. Well, what's unethical, we believe, about that is giving a guy erection on the spot, which means he's probably giving him medication stronger than what he actually needs. Because what we've been told is they will give him an erection on the spot, then they give him an antidote to get it down. Well, if it's done properly, you don't need that. So we do not do that. Not only do we not give you the shots in the clinic, we're going to give you the shots to take home. The cost is a quarter of what those guys charge. So here's how we do it. When you come into our office and you've gone through the testosterone therapy, the oral medication, or you just don't want to try those, and you've chosen to do penile injection therapy, what we're going to do is we're going to sit down with you, obviously go through the history, but we're going to send you home. We're not going to give you any shots here in the clinic. You're never going to drop your shorts here. We're going to send you home with the doses to test in the comfort of your home. Because when they're working with the penile injection therapy, there's two things that we're looking at. We're looking at the dosage and the strength of the medication. So the lower the dose and the lower the strength, the better it is for you. Because that means you're going to be able to use this medication for a much longer time. Because everything, your body will adapt to it. And you'll have to either go to a higher dose or stronger medication in the future, usually. Not always, but many times you do. So our goal is to get you the erection that you need or want on the lowest dosage and the lowest strength possible. So we're going to send you home with doses to test at home. Now, we will train you in the clinic on a model, how to give yourself an injection, and we'll give you all the instructions, and we'll give you the test doses to take home. But we found that's the most successful way to find the patient's best dose, because if there is any desire whatsoever, the medication, if there can be no desire, there can be no feeling, it works 97% of the time. But if there is some desire and you do have some excitement, you can possibly use a lower dose or a lower strength medication to get the same result. And that's the whole goal. So we're going to send that medication home with you to test at home over a period of a week or so to see what works for you. and we keep doing that until we find a dosage that does work for you. Then we provide you with the medication at that dosage and strength to take home and use as needed. So that's how penile injection therapy works. The only possible side effect that's normal with penile injection therapy, even so with the oral medications, is you want to make sure you don't take too much of it. You can end up with a priapism. A priapism is where you keep an erection more than 2 hours. Then you have to take an antidote to get that erection down. If that doesn't work, then you have to have it flushed. And when you come in and talk to the provider, we'll talk to you about that. But you definitely do not want to end up with a priapism. That's why you want to make sure you use test doses to find the lowest dose and the lowest strength possible that works. Because if you get something that's too strong, you can end up with a priapism and end up not being able to get an erection anymore for the rest of your life. And that's why we brought that in-house, and we do that for our patients here. Not only does it save them a ton of money, it's safe and effective for them. You know, we were trained by a specialist and urologist. We follow the same protocols, and we found that's what works best and is best for the patient. So if you have any questions about erectile dysfunction, feel free to give us a call, come by the clinic. We look forward to meeting you.